Welcome to our comprehensive guide on common ocular conditions. In this video, we'll break down several important eye disorders, their causes, symptoms, and treatments. Understanding these conditions is crucial for both healthcare professionals and anyone interested in eye health. We'll start with pterygium, a condition often seen in people exposed to harsh environmental factors, and move through other key disorders such as subconjunctival hemorrhage, Phlyctenular conjunctivitis, Xerophthalmia, Pinguecula, Haemorrhage, Episcleritis, Scleritis, and Staphyloma. Each section will provide clear explanations and practical insights, helping you recognize and understand these eye issues. Let's begin our journey into the world of ocular health. Pterygium is a triangular, fibrovascular fold that extends from the inner or outer corner of the eye towards the cornea. This abnormal tissue growth can invade and damage the Bowman's membrane, which is a protective layer of the cornea. Pterygium is most commonly seen in people who live in hot, dry, dusty, and windy climates, suggesting that environmental irritation plays a significant role in its development. The condition is often symptomless, but in some cases, it can cause noticeable disfigurement, vision impairment if it covers the pupil, or even double vision due to restricted eye movement. Early detection is important for effective management. Pterygium consists of three main parts: the head, which is the apex that extends onto the cornea, the neck, which connects the head to the body, and the body or base, which extends into the subconjunctival tissue. The condition can be classified into two stages: progressive and atrophic. The progressive stage is characterized by a thick, fleshy, and highly vascular tissue, while the atrophic stage appears thin, pale, and non-progressive. Recognizing these stages helps in determining the appropriate treatment and monitoring the condition's progression. Most people with pterygium do not experience symptoms, especially in the early stages. However, as the condition progresses, it may cause cosmetic concerns due to the visible red or white fold on the eye. If the growth extends over the pupil, it can impair vision. In some cases, movement of the eye may be restricted, leading to double vision. Early signs include a red fold, while later stages show a white, tendinous appearance. The base of the pterygium is firmly attached to the sclera, making it a persistent condition. It's important to distinguish pterygium from pseudopterygium. Pseudopterygium is a similar-looking fold, but it is not firmly attached to the sclera. A simple test involves passing a probe underneath the fold. If the probe passes through, it is likely pseudopterygium. This distinction is crucial because the management and prognosis differ between the two conditions. Accurate diagnosis ensures that patients receive the most appropriate care for their specific condition. Treatment for pterygium depends on the stage and severity. In progressive cases, surgical excision is recommended to remove the abnormal tissue and restore vision. For recurrent cases, more advanced procedures like autografts or tissue transposition may be necessary to prevent regrowth. Early intervention can help preserve eye function and appearance. It's important to consult an ophthalmologist for personalized treatment options. Subconjunctival hemorrhage, also known as ecchymosis, is a condition where blood collects beneath the conjunctiva due to rupture of small, loosely supported blood vessels. It often appears as a bright red patch on the white of the eye and can look alarming, but it is usually harmless. Common causes include trauma, mechanical straining, bleeding disorders, acute conjunctivitis, or sometimes it occurs without any clear reason. The condition is self-limiting and typically resolves within 1 to 3 weeks. Treatment for subconjunctival hemorrhage is generally supportive. Cold compresses can help reduce discomfort, and antibiotic drops may be used if there is a direct injury to the eye. Vitamin C supplements are sometimes recommended to support healing. Most importantly, the condition is self-limiting and will absorb naturally within a few weeks. Patients should be reassured that it is rarely a sign of serious disease. Phlyctenular conjunctivitis, also called Kerato-conjunctivitis, is an allergic reaction that results in small, yellow-gray nodules on the bulbar conjunctiva or cornea. This condition is most often seen in malnourished children and is usually triggered by an allergic response to bacterial proteins, such as those from tuberculosis. Symptoms can include redness, irritation, and discomfort. Early recognition and treatment are important to prevent complications. Treatment for phlyctenular conjunctivitis focuses on reducing inflammation and addressing the underlying cause. Topical corticosteroids are used to control the allergic reaction, while antibiotic drops help manage any bacterial involvement. If the cornea is affected, atropine drops may be prescribed to relieve discomfort. It's also important to address systemic factors, such as improving nutrition and treating any underlying infections. Xerosis, Xerophthalmia, and Keratomalacia are conditions related to dryness of the conjunctiva and cornea. Normally, these surfaces are kept moist by tears, oily secretions, and mucus. When moisture is lacking, often due to vitamin A deficiency, the eye becomes dry and vulnerable to damage. Signs include night blindness, betot spots, and a dry, lusterless appearance of the conjunctiva and cornea. In severe cases, corneal ulcers can develop, threatening vision. The mainstay of treatment for xerosis and keratomalacia is vitamin A supplementation. This can be given as injections or oral supplements, depending on the severity of the deficiency. Artificial tears may also be used to keep the eye moist and comfortable. Early intervention is crucial to prevent permanent vision loss, especially in children who are most at risk. Addressing nutritional deficiencies is a key part of management. Pinguecula is a small, raised, yellowish triangular patch of degenerated elastic tissue found on the conjunctiva, usually in elderly people who have been exposed to sun, dust, and wind over many years. Unlike pterygium, Pinguecula does not invade the cornea and is generally harmless. No treatment is required unless it becomes irritated, in which case lubricating eye drops may be used for comfort. Chemosis refers to a boggy swelling of the bulbar conjunctiva, the clear tissue covering the white part of the eye. It can result from acute inflammation, obstruction to blood circulation, or abnormal blood conditions. The swelling can be uncomfortable and may interfere with eyelid closure. Identifying and treating the underlying cause is essential for resolving chemosis. Episcleritis is a benign inflammation of the episcleral tissue, presenting as a hard, pinkish-red, tender nodule near the limbus. The conjunctiva moves freely over it, and the condition usually responds well to topical corticosteroids, NSAIDs, and analgesics. Scleritis, on the other hand, is a more serious inflammation affecting the deeper scleral tissue, often associated with systemic diseases like rheumatoid arthritis or tuberculosis. It causes severe pain, dark red or bluish patches, and requires high-dose systemic steroids and anti-inflammatory medications for treatment. Staphyloma is the outward bulging of the sclera or cornea, often accompanied by the protrusion of uveal tissue. There are several types, including anterior, intercalary, ciliary, equatorial, and posterior staphyloma, each named according to its location. Unfortunately, there is generally no effective treatment for staphyloma, but symptomatic management or surgery may be considered in extreme cases to preserve vision or relieve discomfort. In summary, understanding ocular conditions like pterygium, subconjunctival hemorrhage, phlyctenular conjunctivitis, xerosis, pinguecula, chemosis, episcleritis, scleritis, and staphyloma is essential for proper eye care. Early recognition and appropriate management can prevent complications and preserve vision. If you notice any unusual changes in your eyes, consult an eye care professional promptly. Thank you for joining us in this exploration of ocular health.